Doctors of the Korean Medical Association are on a one-day strike this Monday. This is the response to a government plan to enact reforms in the medical sector. Now, in turn, the government has vowed to come down on the walkout with a heavy hand. Arirang News' Kwon Soa has our top story.
A one-day strike led by the Korean Medical Association began earlier this Monday morning. Doctors won't be providing medical services, and many hospitals across the nation will be closed. However, the health ministry's first estimates say that 29% of doctors in the nation are participating in today's walkout, which appears to be low considering the 77% of doctors who voted in favor of the strike and the Korean Intern Resident Association's earlier announcement of its participation. President Park Geun-hye has expressed her regret about the walkout and reiterated the government's vow to take legal measures against striking doctors, including a business suspension.
The walkout coming in the middle of the negotiation process between the government and the medical association is unacceptable. It's clearly an illegal action that puts public health at risk.
It's regrettable that we had to make the extreme decision of closing hospitals and not treating patients. I'm resentful toward the government.
The KMA strike was called in protest of a government plan to introduce a telemedicine system that would allow for patients in remote areas to be diagnosed via webcam, smartphone, or even email. KMA doctors say it will impair the quality of medical services. The Medical Association is also up in arms over a government move to run for-profit subsidiaries. While the government says it will improve the nation's medical industry, the KMA says it will only lead to a hike in medical bills. Doctors are concerned the reforms could eventually lead to privatization of the medical sector. Following Monday's walkout, the strike will transition to a work-to-rule action starting Tuesday and running through March 23rd, meaning doctors won't work more than 40 hours a week and will treat patients for no longer than 15 minutes. A full 6-day strike is then planned to begin on the 24th, which, unlike today's action, could also include the closing of emergency rooms and intensive care centers. The medical strike stands to be the largest in 14 years, and with negotiations between both sides at a stalemate, some fear it will continue for the long term. Kwon Soa, Arirang News.